Hi, welcome to another edition. I'm James Kirkpatrick and I'm from the recovery room. Today we're looking at plantar fascia, a pain on the bottom of the foot, and especially in runners. So first off, we need to make sure we can identify, is this the condition that I have? So first off, we need to look at is number one, make sure you get it checked out by a professional. Okay, so get it checked out to make sure the diagnosis is plantar fascia, because there are other things that it could be that you need to make sure that you're not doing yourself more aggravation by following this advice. So one, get it checked out. So treatment by a professional. Now next, you'll probably get some pain somewhere in the arch of the foot. So the arch of the foot here, and if we have the toe at this end, the heel bone at this end, this is the foot here. What we'll do is we'll have some pain anywhere from the kind of bottom of the kind of foot or front part of the foot, anywhere towards the heel. And you'll usually especially feel some discomfort where it inserts onto the heel bone here itself. Again, there's other structures that could get aggravated, and you might want to just use a little heel cut to stop there being an impact injury if there's a little bit of a problem with the fat pad that lays underneath. So first off, you need to get your treatment. Number two, you need to make sure that this is the treatment and the advice that's going to be correct for you. You'll also get pain first few steps of the day, and that's going to be really debilitating. So the advice I would use when getting up from a static position or sleeping at night is ankle circles, toe circles. So ankle circles just before you get up from a desk if you've been sat down for a long period of time. It will generally be a bit stiff after a period of inactivity or overnight. Now those of you that need to get up in the night to go to the toilet quite regularly, the best thing to do is put a pair of slippers just by the bed, because the plantar fascia would generally not like completely barefoot. So rule number 4 is no barefoot, absolutely at all. Get in from your day at work, take the shoes off, put some slippers on, no barefoot. That will help calm it down significantly. So no barefoot. Point number 5. On the pain scale, 0 is nothing and 10 is a high level of pain. What we want to do is have anywhere between a 0 and a 3 out of 10 pain. If it goes above that, we're probably going to get more aggravation than we're actually going to get any kind of healing properties going on. And I often find it isn't useful to stop people running, because that just makes it really hard for the person to then start running again after their injury. But we need to make sure, again, that the treatment and diagnosis is right before we start running too far. And if you run a 3 out of 10 pain, that should settle in 24 hours and no consecutive days running. So pain up to a 3 out of 10 on the pain scale, and everyone will be different with this, so just your 3 out of 10 isn't going to be the same as somebody else's. So the exercise that we really need to do now you've got this advice is get some treatment. Underside of the foot. Get the ankle circles after a period of inactivity or sat at the desk. We then need no barefoot at all during the day to make sure you calm down the plantar fascia. And if you're able to run still and you want to run, that is no more than a 3 out of 10 pain, and it settles within 24 hours and no consecutive days exercise. So number 6, what we want to do is now give some exercise to get yourself really engaging those muscles and finding out which are going to be the muscles to propel you forwards. In engaging the glutes part 1, you'll remember that we get into this position just here, we push through the front part of the foot. Now this is quite stressful for the plantar fascia, because the big toe has to compress against the ground and go into extension, and what that will do is it will stress the under part of the foot, it will give it a stretch. So into this position we need to use the glute max, the hamstring, the quads, and also the calf and soleus to push yourself forwards. If that isn't working, or any of those muscles aren't working quite as well as they should do, it could lead to plantar fascia issues. So make sure that you do look at engaging the glutes part 1 and part 2 to make sure you're getting your posterior chain working in this position to unload the plantar fascia. This exercise is really evidence-based. It's really got a good sound structure to it. So we want a towel to put yourself into this slightly stressful position, mimicking the toe-offing gait. So it's got to be toe extended up onto the towel. You may wish to double it up if it's not high enough. We want to have a really good toe extension here. I do this in straight leg and with a bent knee, and I generally do 2 seconds up, 1, 2, 1 second hold, 1, 2 seconds down. So I'll do that 15 repetitions twice with a bent knee, and then 15 repetitions once with a straight leg. So it's going to get into here and slowly lower down. Same tempo, 2 seconds up, 1 second hold and lower down. It needs to be tough at 15 reps, and make sure you're not causing any pain or discomfort to the calf or Achilles tendon, but you may get a little bit of discomfort that gets progressively better as you do more sets and reps of this. So really good exercise to start getting yourself up, but you need to earn the right to get to the next level. So strengthening is far more important than stretching, but you can, if you feel like it's got some value and it feels nice, you can get something like a tennis ball or an ice bottle of water, put it in the freezer, and just give yourself a little bit of an ice massage with a bottle, or just a tennis ball, just to massage the bottom of the foot. That isn't going to break up any scar tissue, but it may just make you feel a little bit more comfortable in the short term. So the next we want to do is get a graded strengthening program. And lastly, this is no quick fix. This is going to be a gradual, progressive exposure to running greater distances, to getting more strengthening through the soleus and calf muscle, more strengthening through the lower limb by looking at my other videos and engaging the glutes part 1. But also there's a free 3-week course if you click the link below this video for strengthening the lower limb to help your plantar fascia unload. Final thoughts are no quick fix. Think of it anywhere between 6 to 16 weeks in some cases. That may take some time of really bargaining with this, but make sure that your running load is not giving you more problems than it is help. So lower your load, increase your strength and conditioning, have a common sense approach with it, and allow yourself to go through the ups and downs of rehab so that you can get yourself to be a better, stronger runner in 6 to 16 weeks time, depending on your condition. My name's James Kirkpatrick. Thanks for watching. Hit subscribe below. You can find me also on social media at Get Active Again. Thanks for watching.